In this video, I will be giving you some more details about PCOS. So when you hear me say PCOS, I'm basically talking about PCOS. And some of us already know that this is something that affects a whole lot of women. WHO has even told us that this affects up to 11% of women based on their estimation. And the truth is that this is actually affecting more people because young women, young adults, teenagers who have already started undergoing puberty and things like that are experiencing these things, but they're not speaking out. They're not going to health centers to complain. They're not adjusting their lifestyles or doing things that will actually help them. That is why this platform is very important, and that is why I'm taking this platform seriously to talk about issues like this and things like this so that people can watch it from the comfort of their homes and then know what to do, know what to adjust so that they can live their best lives. Now, we already know that PCOS has a whole lot of future health implications, fertility implications. It also has psychological and mental implications. Take for instance, how can you now start as a young woman, a young lady, yeah? How can you start telling your friends that you only see your period once in 3 months, once in 6 months? Sometimes you can even go for a year and then you don't see your period. How can you? I mean, think about it. It is embarrassing to talk about, yeah? And they won't understand. They might even stigmatize you. Okay, so that's what people are trying to avoid. Anyways, if you're experiencing something like this, or if you know anybody experiencing something like this and other symptoms that I'm going to mention as we progress in this video, please share this video with them. Share this video, share this video, share this video. Even if you're not a woman, let's say you're a man, you identify by gender male, and you want to share it with your sister, with your loved one, with your girlfriend, with people who you think needs to hear this. Please do not hesitate to share this video. I am Pharm Ebby, a healthcare professional, close on half a decade of experience. Subscribe to my YouTube channel at Pharm Ebby Official. I drop videos every weekend. Alright, so you can learn a thing or two and also share it with people who might need it. Okay, now let's talk about PCOS. Let's begin. PCOS simply means Polycystic Ovarian Syndrome, and this is a health condition that is genetic or that can be genetic. There are so many other causes of PCOS, but I'm not here to talk about those causes. I'm here to talk about what you can do if you have PCOS. Alright, so genetic means that because somebody in the family has it, you can also have it. Yeah, that's what genetic means. And people with PCOS experience things like irregular menstruation, facial hair, or hair on their chest, hair in weird places. That's for women. They also experience sleep apnea, like their sleep is distorted, irregular. They sleep and then it looks like they're choking. They have to wake up because they're having issues with their breasts when they sleep. And then some of them also experience acne. You see acne, we call it pimples. All right, so acne or pimples, anyone that works for you. So you see their face, pimples every time, and things like that. All right, so this video is for them. And then when a woman starts to experience things like that, there is a future implication for that. So you have things like infertility, things like diabetes, things like high blood pressure. So these are the things that can develop from PCOS in future. All right, so now what can you do? What can we do about this? The first thing or the most important thing to note is this: lifestyle. Change your lifestyle. Now, when it comes to changing your life, I'm going to say a lot of things here under this, but just know that everything I'm saying now is under what? Lifestyle. Change your lifestyle. So if you are still here watching this video at this point, please go to the comment section and type change your lifestyle. Change your lifestyle. Type it 3 times. All right. How can you change your lifestyle? The first thing to do is your diet, your food. Let's say you used to eat in the morning and then you don't eat again till your stomach starts to bite you and pain you and disturb you, that's when you now go and eat. Okay. And then the next day you ate in the morning and then 2 hours later, 3 hours later, you're eating again. This means that you don't have a regular meal plan. You don't have a scheduled time of eating, which is wrong, which is not good for you. So what you need to do is do not go on prolonged periods without eating. Set alarm. This is my breakfast time, this is my lunch time, this is my dinner time. And if you need to snack in between, set alarms for all those and stick to it. So the first thing to do is what? Do not go on prolonged periods without eating. Even if you don't have appetite, remind yourself that it is necessary that you eat, that you adjust your dietary lifestyle, okay? And then do that. Next, start eating healthy. So on Twitter some time back, I posted a typical food plate. So if you look at that food plate, what are you going to see? You're going to see that half of that plate is what? Fruits and vegetable. The other half, you divide it to have your what? Carbohydrates, protein, then you have water, fats, and healthy oils. Okay? Start eating healthy. Start. The funny thing is that eating healthy is very important for everybody. Like, it is super beneficial for everyone, not just people with PCOS or anything like that, or any other health condition. So start eating healthy. But because we're in this part of the world where most people are too busy to eat, or they forget to eat, or they say they don't have money to eat, or their salary is not enough for them to eat, I always advise you to draw up a plan, draw a budget, draw a budget, draw a budget for food and say, okay, this is how much I'm going to spend on food every week or every day or every month. And then how can I use this little that I have to achieve a balanced meal, a healthy meal? This is very important. All right. So you can work on it. Start eating healthy. Eat healthy. Fruits, vegetables should be in your diet. I'm also going to make videos about foods, certain type of foods that are good for people with PCOS. Alright, so stay tuned and be on the lookout for a video. Next, another thing that you can do is to work on your stress levels. Alright, so women, I know that you go to work. Okay, sometimes you go to work in the morning, come back at night, every day you're in traffic, you're stressed and things like that. Please work on your stress level. It is very, 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 very important that you work on your stress levels, because there are some kinds of PCOS that is triggered by increased levels of stress. This also means that when you work on your stress level, you can overcome that PCOS and its symptoms. All right, so please work on your stress level. So how can you work on your stress level? Foods like avocado, some nuts, cashew nuts, avocado, bananas, these contain magnesium that can help you relax. Or you can do magnesium supplements. If you don't have time for eating all of these things, get magnesium supplements that can help you relax. Okay. When you go to the pharmacy to get, make sure that you talk to the pharmacist and they can advise you further on what to do. Or you can reach out to me directly. There is a link in the description box below. Check it out. Reach out to me. Send me a DM. Ask me questions about the multivitamin or supplements that you're about to get, and let me advise you appropriately. Alright, another thing that you can do is to relax. Practice relaxation techniques, meditation. I have videos about that on my channel. Please go and watch them if you are yet to watch them. Alright, so another thing that you can do is stay active. Exercise. Stop saying I don't have time to exercise, I'm too busy, I don't have time to. You will collapse. So you will collapse. And this is not a curse or anything. This is just how it works. Exercise, not just walking about. No. Go to the gym or stay at home indoors. Do YouTube videos. Exercise, even if it's just for 30 minutes, 2 times a week. 30 minutes of exercise, 30 minutes of exercise. Let's say on Tuesdays and Fridays. It is better than nothing. So please try and exercise. If you have not been exercising, stay active as well. This will help you with PCOS symptoms. All right. And then sometimes people who have PCOS symptoms are in severe, their symptoms are severe. For severe cases, yes, adjust your lifestyle, but also go to the hospital, get some consultation, get some medications as well. Or let's say you're someone who have PCOS and then you just got married, you're newly married, and then you already notice that it's affecting your fertility and things like that. Go to the hospital, see a consultant, and stay on the medications that they place you on. Alright, so do not forget that even when you're using medicines, you must, or it is important that you adjust your lifestyle. Like I said earlier, that everything I'm saying is under what? Adjusting your lifestyle, changing your lifestyle. So please work on your lifestyle, use the medications that have been prescribed, and you're going to accomplish and achieve better results. Okay? So do that. It's been a great time here this time. Thank you all for watching to the very end. Share this video. Do not forget to share it with people who need it, okay, or people who you think might need it. Also, subscribe to my channel at Pharm Ebby Official for more videos. I post videos every weekend. See you next time.